All right, good morning. I can't see you all too well up here, but happy to have you all. Thank you for joining us. My name's Bonita. I'm actually one of the social workers over at Lucy Kirchi. So I'm happy you all could make it today. It really helps us to have everyone's participation, and we love to hear your feedback. Sure, hold on. How about that? Okay. Yes. So I think you all got our handout, our packet, right? And so inside you'll find a few handouts for a couple of our programs, including our smoking cessation program, information about our breast cancer support group, and our monthly calendar. Oh, it looks like we still have December in there. That's all right. We're coming up to the end of January, so I think likely end of this week, February will be available in our lobby, on our website, so you can find it there. Also on the left, we've got, if you could please sign the consent statement. We are recording audio, no video, but we record audio for all of our lectures, sometimes video, so we can post it on our YouTube channels. So that way anyone maybe that wasn't able to make it, they can watch it back later. But this one will just be audio. We also have an evaluation form, so you can save that one till the end. Let us know what you thought about the lecture, about the information, and maybe what you'd like to see next time. We read all of them, and so we consider everyone's input. And so just to get us started, we have our three presenters today, including Gemma Bautista. She's been an Eisenhower employee for almost 3 years. She started working at acute care and inpatient in the hospital and has been a certified lymphedema therapist for a year. We also have Courtney Faye Lavassieur. She was born in Minneapolis, Minnesota, and moved to San Diego in the late 80s with her family. Her mother is a retired physician, her grandmother was a nurse, and several cousins and other extended relatives are also in healthcare, so it runs in the family. She graduated from the University of St. Augustine of Health Sciences in San Marcos here in California in 2015 and pursued a master's in occupational therapy. She was nationally board certified and California licensed in summer of 2015, and then started here at Eisenhower in September of that same year. She pursued lymphatic therapy in the summer of 2016, and by October, became a certified lymphatic therapist and certified in decongestive therapy, then advanced on to advanced lymphatic certification in truncal, abdominal, and pelvic lymphedema. She is also certified in the Vater technique for post-surgical procedures and reconstructions. She feels fortunate to work with an excellent team of therapists who continue to grow every year. They work hard to promote our lymphatic protocol and care for our patients, spouses, caregivers, and other medical professionals so that our affected patient population can have an increased quality of life and beneficial journey with us. And we also have Danielle Meglio, who's been a certified occupational therapy assistant for 32 years, a certified manual lymph therapist for 20 years, and has worked at Eisenhower for 29 years in the occupational therapy department. She is also the rehab community class coordinator and works with our community on lectures, events, and health screenings to the rehab department. She currently teaches the strength training and Tai Chi classes for cancer patients and survivors over at Lucy Kirchi Cancer Center. She has taught at Loma Linda University in the occupational therapy department and given a guest lecture for both Santa Monica College and West Coast University to provide education on lymphedema and the importance of occupational therapy in cancer care. Danielle is certified in Tai Chi, strength training, Labed Healthy Steps and is a 200-hour yoga instructor and teacher. She's also an instructor of self-help classes for lupus, arthritis, multiple sclerosis, fibromyalgia, and cancer. She's worked in many areas in the rehab department, yet finds lymphedema and cancer to be her main focus and strives to educate her patients in a health and wellness when working with them. Her passion has become working with cancer patients due to all of her experience and the personal journey she's gone on with her fiance, who is now a 2-time cancer survivor. And so, thank you guys whenever you're ready to start.
So hello, everybody. How are you? My name is Courtney, like I was being introduced. I'm just going to set my notes right up here and kind of just let you guys know I don't necessarily public speak too much, and I'm more better on a one-on-one basis, but I'm going to do my best. So if you can't hear me or if you have trouble hearing what I'm saying, please just let me know. I'm happy to repeat or slow down. Okay. So living beyond cancer, this is becoming more reality every year. We are having people being able to survive cancer, but it's not necessarily that that journey ends there. You know, we have to think about the aftermath, how we're going to increase our quality of life. Cancer treatments really do a number on someone, don't they? Yeah, okay. So I bet everybody here has that same experience in some way. But I do, when I bring people into the clinic, when they come in for an evaluation, I basically educate them about the lymphatic system, teach them what it does, you know, like how it helps you, why it's so important. Also, like this is the journey where you get to learn more about your bodies. Sometimes people don't know enough about them. So we need to kind of teach them how to learn a little bit about their bodies, know what it does, and how we can help them. So our first slide is basically going to be, what is the lymphatic system? So there is a superficial network, which is basically kind of lives in the skin. It directly involves the lymph node groups. So you've got the lymph node groups in the axillary region and also in the inguinal area. There is a secondary system, there's a secondary system that's called the deep network. And the deep network is also truncal. So it's all around the heart, the lungs, the organs. So that's a big network of system, okay? In this whole area, all of the lymph nodes in your body, there's about 600 to 700 lymph nodes in the entire body. You have about 60 of them in the axillary area on either side. You also have them in the inguinal area, and that's including also the truncal area. But the most important place is actually in the head and the neck. So you actually have most all the lymph nodes in your body, almost all of them, actually about a third of them, are in the head and the neck. And does anybody know why? Okay, well, it has to do with the fact that we have many openings there. So we actually have to protect ourselves against the environment a little bit more because we have more openings in our head and neck. We have the eyes, the ears, the mouth, the nostrils, all those types of things. So what the lymphatic system does, it's a deep network of vessels, lymph nodes, lymphangins, basically all these things that kind of help move the lymphatic fluid around the body. So the lymph fluid includes water, debris, minerals and ions, protein-rich fats, and also white blood cells. Did you think that was actually moving around in your lymphatic system? So this kind of gives you an idea of what the lymphatic system looks like. This is kind of a superimposition right here. You can see a lot of them up in the head and the neck right here, right in the axillary regions here, and then in the inguinal areas here. These are all pelvic lymph nodes here. This is more inguinal here. So you can kind of see the different like labels here. This is an actual lymph node right here. And this actually has got about the size of a lima bean, if you want to kind of have a little bit something to compare it to. You have the lymphatic fluid that comes in one direction and then gets cleaned and filtered in the lymph node and then pushed out again, okay? So that's kind of how that works. This right here, so these lymph nodes right here, this one, these are all over the body. Doesn't matter what kind, if it's deep or superficial, it's always going to have lymph nodes attached to it. Here, this is actually a cross section of the skin. I apologize for the quality of this picture, but to generally let you know this is a deep lymph node, so something like a pelvic or an abdominal lymph node. This is superficial, so that's going to be more in the axillary and the inguinal area and the neck. And then right up here, we have like a little network of vessels that actually live in the skin. So when it lives in the skin like that, we are able to use our techniques to be able to help move that lymphatic fluid along. And that's how we stimulate the lymphatic system, is through this superficial system right here. We also do have credentials, Danny and Gemma and I, as well as everybody over at the clinic, have the ability to be able to stimulate the deep lymph nodes as well. But mainly the massage that we do is going to be stimulating this area here. Okay, so moving on. So what does the lymphatic system do? We already gone over that. It's a production of white blood cells. It's basically your immune system. So it helps you kind of fight infection, anything like that. It cleans and filters the lymphatic fluid. So that's how when you get an infection, so say that you get like a cut on your finger, the lymphatic system is primarily responsible for creating that histamine response that goes and starts to clean the wound. And when it starts to clean the wound, that is through the lymphatic fluid, and that's pumped through the lymphatic system to be able to clean and filter itself through the lymph nodes. So it regulates the body fluid levels. So that's why a lot of the people here that I see, smiling faces of my patients, that we're always promoting: drink enough water, stay hydrated. We want to continue to flush a lot of that stuff out. It regulates the absorptions of fats. And generally, it's the first line of defense against the environment. So anything that happens in the environment, your lymphatic system is going to help you with your immunity. This is another great slide here. It kind of shows you the difference between the circulatory system, and I'm going to move over here so you can kind of see this. You can kind of see that these two systems right here, they kind of superimpose each other. If you kind of put them over the top of each other, like that, the only difference between the two systems is one's carrying blood and one's carrying lymph fluid, okay? Another difference is that the lymphatic system is a one-way system. So it starts in the capillary beds at a very microscopic level, and then it starts to pull the fluids and the ions and the minerals out of that interstitium or out of that area of the skin to be able to start cleaning the area to be able to bring it up into the lymphatic system. So if you want to think about it as plumbing, like I do explain it to my patients a lot that way, you think of the beginning of the plumbing being in the capillary beds, which is right here. So right over here. Okay, then it gets sucked up into the lymphatic vessel, cleaned and filtered through the lymph node, and then dumped into the veins here. So this right here would say, let's make that B. So you have A down here, and then you have B. Okay, this is your drainage point. So what happens is that to be able to move lymphatic fluid along, we're going to need to do muscle pumping. We're going to need to do compression. We're going to need to do all these other things to be able to create negative pressure in the system, a sucking motion that will stimulate it on a capillary level. Does that all make sense for you guys? Okay. Whoops, hold the phone. Oh my goodness, did I go too far? What happened? Sorry about that. Okay. So how does the lymphatic system move fluid? Internally. So it's the absorption of fluid through lymph capillaries in the interstitium, pre-collectors and collectors, which I just explained. It's more of the medical type of side of it. The suction through the negative pressure of the lymph nodes and contraction of the lymph vessel smooth muscle, which is a little small pump called the lymphangin. And that's kind of in between the lymph nodes along the way in your body. Externally, this is a lot of the stuff we deal with in the clinic here, and Gemma will go ahead and get back to or give you more information on that, but it's muscular contraction. We do it with breathing, even like moving your intestines around and digestion of your food is going to move that lymph fluid along as well. So if you have any problems digestively or if things moving slowly, sometimes that can affect how big your belly gets or how much fluid is being pushed around in your body. The pulsing of arteries, just like the regular circulation of the circulatory system, is something that also kind of stimulates the lymphatic system as well. External compression, like I mentioned, like a sleeve, sometimes a thigh high, any type of compression to be able to help with that negative pressure and pumping of moving that fluid along. And then also manual therapy, which is what we're all certified in over at the lymphatic clinic. So what is lymphedema? Lymphedema is a symptom. It's not a disease. It's a symptom of an impaired lymphatic system. So the lymphatic system has been slowed down so much or damaged in some way that it's not performing the way that it should. So you have two different types, which is basically the primary. So someone is born with it. They have either a smaller amount of lymph nodes, maybe they don't have they have some anatomical difference that's not working for them, that's not working with their lymphatic system. There are also conditions that are associated with this. Secondary is going to be more along what we're dealing with here today, is that it's acquired via surgery. So when they take a lymph node biopsy, they take several different lymph nodes to find out if the cancer had actually gotten there. And then radiation. Radiation does a lot of damage to the superficial skin, and sometimes the lymphatic system can be damaged from that. It doesn't mean that it'll be lasting effects, but people do struggle with a little bit of lymphedema during their radiation process. You can get it through chemo. That's more of a global swelling because, chemo is basically one of those types of drugs that your body does not like. So it's going to react to it, kind of be like an inflammatory response. So some people can get a lot of swelling from just their chemo treatments. Traumatic, basically, if you get into a car accident, have a crush injury, anything like that, that can also impair your lymphatic system. Immobility, people who are not exercising, people who are not out and about and doing things, not being part of their lives, not having any social participation, that type of thing. That can also contribute to lymphatic issues. Malignant tumor in cells, we all know about that. And then chronic venous insufficiency, which is something we're not going to talk about today. So we'll kind of graze over that one. And the same goes for filariasis, which is actually one of the reasons that, or one of the first things that people got to know about what lymphedema was. This is an actual parasite that attacks the lymphatic system. So that gives somebody a limb like this right here. This is changes in the lymphedema after 7 months of integrated treatment. So this person came in with that size of that leg at the very beginning, and then after 7 months, his leg became like this, okay? But I have to mention to you, though, that this person is a very compliant patient. They wore their compression every day, they exercised, they did their lymphatic protocol, they got their massages, they did everything that they could to be able to get those results. So if you don't put in the work, you're not going to get the desired results that you want, All right. The stages of lymphedema. So basically there's 4 stages. Stage 0, nothing. You're totally normal, okay? Stage 1 is minimal to no edema, soft, supple skin. There's no discoloration. It might look like a little bit of swelling or something like that. Stage 2 is a moderate edema. You can actually see a change in girth. Maybe your clothes get tighter. Maybe you can't wear those fun jeans that you would like to wear, or wear that fun shirt that you would like to wear because you feel more tight in those areas. Sometimes with stage 2, it can get to that moderate or severe stage 2 where those changes in the skin and those tissues can become permanent. It's not reversible anymore. Okay, and typically stage 2 does not resolve with any elevation. So basically when you're elevating your arm or elevating your legs, that swelling is not going down, and it typically doesn't go down overnight like it usually does. Okay. Stage 3 is more severe lymphedema. The gentleman that was pictured before, that's more severe right here. But you can also see the skin changes right here in his skin. That's probably not going to go away. So you have severe hyperkeratosis and skin irregularities. So you get a lot of like irregular skin. Your skin becomes hard, like an orange peel, kind of crusty. It doesn't look very healthy. Sometimes it can become hyperpigmented, so you know that there's some circulation issues going on there too. And when things start staying there, you actually have a problem lymphatically with wounds because you're not getting the proper skin turnover or anything like that. So you're actually probably, if you do get a wound, you can't, it's going to be a chronic wound. You're going to have a hard time healing it. And then the signs and symptoms of lymphedema, this is going to be a little bit more for what you guys would want to know. It's tightness in the limb and trunk. It's heaviness. It's a new onset of pain. Typically, it's a burning, dull ache type of pain that someone has. There's sometimes can be like a little bit of neuropathy that's a little bit associated with it. So sometimes you can get a little bit of like, fingers that are feeling a little numb or tingly, feet that are feeling a little numb or tingly. That happens because the compression of the lymphedema or the swelling on the nerves create that sensation. There's also skin inflammation. So you're getting redness and weeping, and weeping is when the skin stretches so much that the lymphatic fluid starts coming out through the skin. And that's how you know that people can start getting a little bit more skin breakdown and more wounds. Also, skin with a shiny or a stretched appearance. You know how sometimes when you get so full, your skin becomes shiny or just becomes really stretched out. And if you feel like you just put a little needle in there, it'd be like a little sieve coming right out, right? But that's not what we want you to do. But it also just kind of gives you that idea that that's the stretched skin that you're dealing with. There's an absence of wrinkling, of course. Significant increase in the girth of your limb. You can't wear clothes that you like to wear, like I had mentioned before. Drastic weight gain is usually another indication, like you gain weight very quickly within a week, 2 weeks, that sort of thing. And also you kind of get recurring infections. So recurring infections are because the lymphatic fluid is not moving in your body the way that it should to be able to be healthy. And this is where I'm going to be stepping out and Ms. Gemma is going to be taking over, but I wanted to show you kind of a picture and let you know that this is mild stage 1. Can you guys see the subtle difference in her legs? Yeah, okay. This is going to be mild stage 1. This is moderate stage 2. You can still see her legs getting a little bit bigger, but her thigh got a little bit bigger. You can see a little hyperpigmentation right up top right here. Not anything down here though. This is a moderate stage 2. Clinically, I would say this is probably more of an initial stage 2 for us, for what we see in the clinic. And this right here would be more of a moderate or advanced stage 2 right here. This is borderline stage 2, stage 3 right here. But the only reason why they're staging it at 3 is if you look at her other leg and you're comparing it to this, it's almost twice the size. So that's when you're dealing with the stage 3 leg. This right here kind of shows you a little bit about the hyperpigmentation. It always is going to be in the calf area, the shin, places where you don't normally have a lot of circulation in general. The muscle bellies have a little bit more circulation, so those muscle belly areas on your skin are not going to be as hyperpigmented as, say, like your shin or your lower ankle, your upper ankles. And then this right here is a lady that has a lymphatic arm right here. And then this is her normal size of her arm. So this is about a stage 2 arm, hyperpigmentation right here. And then she's got, a lot of swelling and fibrosis here. Okay. So do you guys have any questions about this particular section, or did that all sound kind of clear so we can move on? Good. Come on down.
Hello. Okay, good morning. My name is Gemma. So I will keep this slide for a little bit. So what should we do once we felt there's a change in our skin presentation, when we feel tightness, swelling starts to develop in our body? So what should we do on that one? The first one is we need to get a referral. It might come from your primary care doctor, your oncologist, whoever is treating you with your problems, with your disease, with your cancer and everything like that. The second is, once we get the referral, you're gonna have the evaluation. We have 3 in the clinic, which includes Courtney, Sarah, and Vanessa. And what entails during the evaluation? So the evaluation, we will review your history, the course of all of your treatments, what happened before and after. Next, they will take the measurements. So we advise or we recommend you guys to wear loose fitting clothing. Either if you wear something like what you're wearing today, if it's in the upper extremity, we might request to remove your clothing. If it's the lower extremity, we might request you to take it off so that we can get the baseline measurements. And we will discuss with you your course of treatment, how often we're going to see you, and what type of compressions are we going to be giving you in the course of the treatment. So what is our goal while we're doing all of this for your presentation? Any guess? What's the goal for the lymphedema therapy? Get rid of it. Any takers? Any clue? Okay, that's a good one. Anything else? You got it. But we cannot get rid of it. Never. We can only manage it to the point that we can increase our mobility and we can continue functioning daily. So the goal is, if we're having like this, we're going to reduce it to a point that may be closer to this one or that one. So that's our goal for the therapy. And we'll also going to give you all the education, all the knowledge and skills to manage your lymphedema. That includes also if we have social support, our family, our caregivers. So we have to involve them in our treatment. Next. All right. So I would like for you to look at the entire picture. What do you see in this image? Yes. What resonates to you in the image? Exercise, massage, what else? Okay. Is there a difference between the top portion and then the lower portion? Is there a difference? You got it right. All right. So we don't see any difference between the phase 1 and then the phase 2. Probably there's a difference in pictures, but the treatment and management is both the same. For phase 1, we have skincare, we have manual lymphatic drainage, we have self-management, we have compression therapy, and we have exercise. For the phase 2, which is the maintenance and maintaining it, optimizing it to the point that we're not going back to the bigger side of us previously. So, but it's still the same. It includes exercise, compression, self-management, manual, lymphatic drainage, and skincare. So the only difference is that during this phase, it's intense. We have to make sure we're reducing your swelling and we're improving your skin presentation. If we're on the hard fibrotic tissue, we want to make sure we're softening it up. If you have a dry skin, we want to make sure it's moisturized. So that's the only difference between the two. But the phase 2, it's more on you as a person, because this takes a lot more on you at home. So we'll talk about the skincare. So any idea on how to do the skincare? What you do at home to moisturize? All right. Lotion. For wounds, you go to the doctor for wound care. For lymphedema, we do basic, we clean, we do simple bandaging. But we go to the specialist to do more intense treatment for that one. For skincare, you're right. You have to wear lotion. You have to use the lotion morning and night, preferably. And also, if you're going outside, if we're on the summer, you have to wear kind of like a sun hat, sunblock to protect your skin. Don't wear tight clothing, tight jewelry in a certain area. If you have blood work, avoid having it done in your right side or on your left side where you have your symptoms. And blood work, blood pressure taken, if we can have it on the other side, that's the non-affected limb, please, we have to do that on the other side. Next, let's do the exercise. Exercise doesn't have to be that you have to go to the gym. Have a membership. Walking is one of them. House chores also, that entails activities. You're moving, you're going to the bathroom, you're going to the kitchen, you're cooking, cleaning. As long as we're moving, we're not sedentary. If you do swimming, we can go swimming. If you do golf, you can do golf. But we're not asking you to do like, go get a gym membership and do weights and everything like that. Simple movement will do. Next, we do compression. I've known familiar faces, some of here, and I know they know what compression is. Okay, so it's something that you have to wear, medically designed for lymphedema, not the one that you can buy from Walgreens, Walmart, Amazon. I think they sell some from Amazon if they cannot buy it from our vendor. So we recommend we have our own vendor where we get our compression. So we will give you the idea where to get it. And we are asking to refrain on buying, I would say, unnecessary items. So compression is important because sometimes patients will come in here and they have sheer hose compression that you wear during your dresses. It's nice to have that, but it doesn't contain and support your legs or your arms when you're doing movements. The next part is the manual lymphatic drainage or the simple lymphatic drainage. This is what we do in the clinic. After your first evaluation, if we have time for the first evaluation, then we can give you a massage. But usually the first session, that's when we're going to give you your first MLD, your first massage. So we will ask you, this is an intimate process. So we ask you to take off your pants or you take off your top. And then either you're sitting down or you're laying down in our table. So we're doing a gentle skin stretch on your skin, moving from the affected limb to the area or the region where it drains well. So we do that. We from head to toe, and we concentrate on the areas where you're most affected with. After the first massage, if you haven't done any massage before, when you go home, you might feel a little bit pain, sore, fatigued. For us, it's a normal response because we're dumping toxins to your body. We're eliminating them for the first time. And then we ask you to hydrate. Drink a lot of water. Also, at the clinic, we will also teach you how to do the simple massage that you can do at home. We call that like flush the toilet. That's our main words, flush the toilet. So you will do that at home, morning and night. You have to massage yourself, your neck, your armpits, and your inguinal area to maximize the fluid return to your body while you're doing your exercises. And next, the last part on the phase 1 is the self-management. What do you think self-management entails? Discipline. I like that. I like that. Discipline. What else? Commitment. Ooh, we're deep diving. Okay, next. Any idea what commitment? Exercise? Mm-hmm. Okay, what else? Self-awareness. I like that too. Diet. Good. All right. Two more, maybe. On this side. Self-management. Massage. Yes. Garments. Okay. So self-management involves everything of this plus us, plus the therapist. So this self-management is where you're going to learn everything and carry it over to your homes. And also, this also entails letting our caregivers, our significant others, our spouses, how they can help us in a way that we can manage our lymphedema. Because it's a teamwork. It's not just us therapists, it's also on you. We cannot just do yes, ma'am. Yes. Yes, we do. Some people, some of our patients do that to themselves. Yes. So self-management, as she mentioned, dry brushing. This is important because if we don't carry over things at home, we will gonna have a hard time doing the stage 2 or the phase 2, the maintenance part of it. In this phase 1, we have to make sure we're starting to get the routine, we're doing our self-discipline and doing your exercise, your self-massage, your compression, and your skincare. So that this number 2, phase 2, is a carryover of what we're doing on the phase 1. So if we're in the slacking part, as a therapist, we cannot do everything alone. So it's a teamwork. So when you go to the clinic, as therapists, we have things to do. Sometimes it's kind of like I kind of like feel that, oh, she's always asking about compression. Oh, she's always asking about, did I do my exercises? Well, it's just a check if we're doing it because it's important. If we want to feel better and if we want to see progress in our presentation before and after, phase 2 is important. So we're teaching you all of this in phase 1 so that we can do the same thing on phase 2. We cannot always see you twice a week forever. Yes. So it's kind of like it's hard to hear it, but that's the reality of it, okay? So don't feel bad when we say, oh, okay, this is the last week that we're going to see you twice a week. And then next week, we're just going to scale down to once a week. There's a reason behind it. We're backing off to do the phase 2. So don't get mad and don't get offended where we're saying, oh, we're going to see you twice a month. It's a partnership, believe me. It's hard. I've tried compression and it's a struggle. So it's important that you let us know as therapists which area you're having a hard time. Open communication, which I'm having a hard time putting my compression on so that we can problem solve. Okay? All right, let's see what I'm gonna do. Oh, I discussed everything. I'm not doing that. All right. So for Eisenhower, we do the MLD, the lymphatic drainage, lymphatic decongestion, We don't do the reconstruction. We do the exercise. We have the pump. Oh, I'm gonna talk to you about the pump. That's the last resource tool that we can give you. So sometimes patients would say, "Oh, they're giving me the pump, so I think I'm done." They gave me the pump and I think I'm done with my treatment. I don't receive massage anymore. Well, the pump is the one that's going to give you the massage at home. That imitates what therapists are doing in the clinic, in the comfort of your home. So you have to sit there in your bed or in your recliner for an hour, and it does the massage technique either in your arms, in your abdomen, or in your legs. It's a machine that mimics my hands, Danny's hands, Courtney's hands in your body. In the comfort of your home, you don't have to go to the clinic. But when you got the pump, you have to still do. You still have to do your exercise, your compression, your management, your self-massage, and your skincare. Pump is an addition, a complement tool in all of this. Any questions? Yes. We have we have at least 10, if I'm not mistaken, 10 MLD certified in the public. Yeah. All right. So any questions on the treatment and management of lymphedema? With whom? The public?
Oh, sorry.
Yeah. You might want
Is it on?
Yeah.
Oh, so so basically the lymphatic trained people in the community, there are some people that will come to your house, okay? So when they come to your house, that's great. And there's also the spas that will also give you a lymphatic treatment. You know, there are detoxification. So they're going to actually kind of get rid of all the toxins in your body. That's like the new thing to go and get the spa and kind of like get that treatment. But however, sometimes you have to be careful. Some of them are not oncologically trained, meaning that you're not going to be able to get the same treatment if you were to come to Eisenhower, whereas we are oncologically trained and we know how to drain you because of your cancer. So if you have a lymph node taken out of the armpit and you go to a regular massage therapist that doesn't know how to reroute the body, then you're not going to get the results that you want. And it would be, you know, kind of detrimental to you and your pocketbook if you paid out of pocket for something that and didn't get to what you wanted.
You guys are open to the public, even if you're not Eisenhower.
No, you have to come. To come to our clinic. You have to have a referral and a diagnosis of lymphedema. Yeah.
Anything else? Okay.
So sometimes with people who actually have more swelling in a limb, you can get some like neuropathic or some kind of neuropathy in your fingertips and in your feet because of that. But you have to also remember that if you've gone through chemo, you can also have those symptoms as well.
Okay.
So typically, if you have not had chemo or haven't had treatment in a very long time and you're having a bad bout of like a lymphatic response, or your arm is getting bigger and then you start experiencing the tingling and numbness in your hand, that's going to be more swelling related.
Okay.
And some people actually say, you know, I don't really have a lot of tingling, or I do have a lot of tingling in my fingertips, but it gets worse when I get more swollen.
Mhm.
So that's you know that it has something to do with the excess swelling that's happening in their hand or their feet.
I went to the blood disorder and myeloma talk, and they talked about brushing. Was that the dry brush? But they said castor oil.
So
for your
dry
s-
brushing can be done with any type of topical oil. It can be done with castor oil. It can be done with fractionated coconut oil. There's a big move right now with castor oil being very healthy for your body and your skin, but it doesn't have to be done with castor oil.
Okay.
So yes, and dry brushing can be even done without any oil. We have lots of people that will use the different tools that do the massaging on the face, and you can just get a dry brush and just brush the skin. You're not brushing hard, you're doing a gentle, like if you were petting a cat or a dog. And yes, that can be done with or without any oil.
And where do you get this dry brush that's good?
The dry brush is on Amazon, and if you look up lymphatic dry brush, there's a couple different ones that you can get. There's one that comes in a pack that has several different heads and then also has an extender, because a lot of us, unless we're Gumby, can't reach behind our backs and things. There's also another one that is highly recommended by those who do dry brushing as part of their treatment. They have little rubber knobs inside the dry brush. So it's a combination of a little bit of pressure and brush at the same time. But they're very conveniently to be bought on Amazon. Unfortunately, our Bed Bath & Beyond went out. They had a bunch of the brushes there, but you can look up on Amazon for that.
I had a question you mentioned about the compression socks. Do you have to be a patient here in order to have access to purchase those? And is there a brand that?
I can't really recommend a brand because I don't know what your limb looks like or what you're dealing with. And no, you don't have to be a patient here. We do have local vendors. The importance of becoming a patient here, even if it was just one treatment, is that we can evaluate you and assess you and know what type of compression you need, so that you're using really quality medical grade compression versus the ones off the shelf that can cut into your skin or bind or don't offer enough compression. So you can get a referral to come and see us to be evaluated for compression, even if you don't have lymphedema, if you have swelling. Like we didn't talk about the vascular swelling. We see a lot of patients in our clinic as well for vascular swelling, which can maybe not turn into lymphedema, or you have a mixture of lymphedema and vascular. So there is a vendor out here that does, a couple of them that do sell compression garments, but it's just nice to be medically evaluated to see what kind you need. Does that help answer that question? Yes and no. Okay.
Can you be referred by a non-Eisenhower doctor?
Yes. Yes. And we do see Kaiser patients, but do know that when you have a Kaiser health plan or IHP or an HMO, sometimes it takes a little bit longer to get in because we have to get authorization from your health plan. So don't get frustrated. We can see you. It just may take a little longer.
I was advised that during radiation you wear compression. What do you say about that?
You can wear compression during radiation, but if your skin becomes too irritated or burned, or there's other issues going on, then we recommend that you not wear the compression until you've had a chance after the radiation and you're healed. Then we get you back into compression. Some people don't have any trouble at all during radiation, and we can put them in a light compression, and then after they heal, put them more in a medical grade compression afterwards. I have a few slides to go through, and then we'll answer some more questions. Because my part is this is the patterns that the other therapists were talking about, how we do the massage and where it's directed to. That's why we open up the lymph nodes. It's like opening up the freeway first so all the lymph fluid can go through, right? It's like being stuck on the 10 freeway behind 100 cars. You're not going anywhere unless the cars are moved, right? So this is everybody's dreaded topic to hear about, exercise. Exercise is so important, and exercise can be anything from walking from your chair to the bathroom, from your chair to the post office box outside, going and getting your mail. It could be walking down the hall, up and down the hall several times, especially if we're not able to get out and exercise. But the reason why you need to exercise is you need the muscles to pump. The lymphatic system does not have its own pumping system. So if you don't have a pumping system, you have to do it through movement, massage, and compression. Your stretch and strengthening. So yoga, Pilates, Tai Chi, and Tai Chi is really good too, because if you have neuropathy in your feet, which is chemo-induced, Tai Chi helps with balance. It also helps with memory and it helps with relaxation because whether you're pre, during, or post-cancer treatments, relaxation and being mindful is very prominent in how to heal. Use of compression garments when exercising. So yes, we do have people that wear their garments when they golf, when they come to my exercise classes, and when it's 120 outside. Everybody says, well, I don't want to wear compression because it's hot and it doesn't match my outfit. Well, when you're dealing with lymphedema, if it doesn't match your outfit, that's okay because you got to keep your lymphatic system under control. Importance of having a consistent routine that includes all of the above. So here at Eisenhower, if you are a cancer patient, a cancer survivor, whether you've just been diagnosed, you're going through treatment, or you're out of treatment, there's no excuse why you shouldn't be exercising because we have 3 classes that are offered to you for free. All you need is a doctor's prescription to come into class. So that's yoga, strength training, and Tai Chi. So that takes care of one excuse. And I've heard them all, trust me. So this just kind of shows you different things. This has become very popular right now, a rebounder, a mini trampoline. So yes, you can use a mini trampoline, or you can go up on the ball of your feet and just do this because I am vibrating my lymph system just by doing that. But there's one caveat to this. If you have osteoporosis, or if you have fragile bones, or if you have a medical condition that you should not be doing that, or the vibrating plates. Does everybody know about the vibrating plates that are out there? So the first one that was introduced was a power plate, and now they make them for home use. And we use it in our physical therapy program where they work on neuropathy. You can use that too. It's at a frequency where it vibrates the lymph system and it helps you drain, and it's good for all over health. But you must ask again your physician if you can use one of those because we never know what's going on with your body. And God forbid you get on one of those, and if you have severe osteoporosis and it fractures because you were jumping on the trampoline and you got a little too vigorous and off the trampoline you went. We've had that happen. We've had TheraBand. Swimming is fabulous. Have you ever gotten into the pool and gotten out and go, wow, I have to go to the bathroom so bad? Do you know why? Because the hydrostatic pressure is massaging your lymph system, so you have to go to the bathroom. That is fabulous, and it takes off 90% of the weight off your body, whether you're 2 pounds or 600 pounds. Takes off 90% off your body. Walking with walking sticks to give you guidance. Biking, but the best is walking because it's also weight bearing. So if you've gone through any cancer treatment, we want to keep our bones healthy. So walking is great. If you can't walk on land, walk in the pool. In the pool, you won't get weight bearing because they've done studies in Europe. They've even gotten the weight as low as around your ankles, and it's still not deemed weight bearing because of the buoyancy in the pool. Compression garments. So when you start the first phase, like Gemma was talking about, we might be doing bandaging, we might be doing kinesio tape because we want to get the girth of the limb to come down. We want to get the tissue to soften. Those would be the things that we would use. And then once you get more into a maintenance stage and we get things managed, we can use inelastic or elastic. Inelastic is compression wraps that Velcro. So if you have a hard time with your hands or it's hard to bend over, you don't have anybody at home, and I'll show you a picture of those. And we also have a brand that's from Medi that's called a Redux kit. That can be used in the first phase because as your limb goes down, we cut the garment to fit your leg or your arm. And then that becomes a permanent garment. And then we get you into an arm sleeve or a leg, like a thigh high. So here are the pictures. Here is our bandaging. Here is a Velcro wrap, 2 forms. Those can come into one that would be a permanent usage. They also have a night garment that reminds me of the pads that you use to take things out of the oven when they're hot. So it looks like a quilted pot handle. And then you have a sleeve, and you have thigh highs, And this is a great picture of the kinesio tape. So you don't have to be an athlete to use kinesio tape. We found really great outcomes just using kinesio tape. So let's say there's a day where you can't wear a garment. You can use the tape and it helps to regulate your swelling and keep it down if that's appropriate for you. Nutrition and hydration. Whenever we talk about hydration, I hear, I don't like water. I don't want to drink water. You need to stay hydrated. You have to filter out the kidneys that then filters out through the bladder. We have to get rid of what we are moving. And if you're not hydrated enough, like the girls were saying, you can actually feel sick the next day. So if you've had a normal massage, what's the first thing the massage therapist tells you? Drink water, because they're releasing toxins from your muscles and the body. We're releasing all that stuff Courtney was talking about that's filtering through your lymph system. And 10 to 15% can come out through your urine, and 8 to 10 can come out through a bowel movement. So some people have said, after I had a massage, I felt like I had diarrhea. That can happen. So the Mayo Clinic recommends 3.7 liters for men and 2.7 liters for women daily. We had a talk the other day with Dr. Sonia Fung. She and other doctors around have said you can do half your weight in ounces of water. But whatever it is, I ultimately ask, whether it be hydration, using electrolytes, or your food, that you talk to your physician, especially if you're still working with an oncologist. You can also get a nutritional referral. Everyone wants to know, is there a special diet for lymphedema? No. You might hear a lot of people talking about keto diets out there that have been working for some patients. But the biggest thing is, what are you eating that's causing inflammation? The two culprits are white sugar and white flour. We want to limit those. Soda is not good for us either. The soda can create kidney stones. So you want to eat things that are what we would find naturally: fruits and vegetables, low fat, low salt, high in fiber, and a really good amount of protein. So you need to find out what is the protein level you should be taking. And if your doctor says 30 grams of protein per meal, there's a reason why they're doing that. I thought I was going to go crazy, because when my fiance, this last time when he was going through chemo treatment, we had to make sure he got in 5,000 calories a day. And we were doing 60 to 100 grams per meal of protein. So there's a reason why you're going through treatment. You're healing. We're all different. Some of us are tiny, some of us are bigger. So please consult with your physician on anything that you do to change your lifestyle: diet, hydration, and exercise. And then the lifelong management that we've been talking about is the importance of establishing a daily routine. Yes, we're all guilty of, oh, too tired today, just leave me in bed. I don't want to do that. But it's important. We want you to stay healthy. Doing your lymphatic opening 2-3 times a day, doing your exercises daily that could be different, wearing your compression, making sure that you are getting out and you're getting moving, getting a little bit of sunshine. Most important thing that I hear, if you have a caregiver, they need to be involved. And the other thing is, I hear, oh, I can't ask my husband to do that. I'm bothering him. I can't ask my wife to help me. No, yes, you need to ask your husband or wife to help you. Put on some compression. It takes 5 minutes, unless your spouse has physical ailments. Like we have some patients that their spouse has really bad arthritis. So then in that case, we have to find another opportunity. But you're married to that loved one. They've been with you for years. I had patient just told me they've been together 75 years. I would hope that putting on compression for a few minutes is okay. Because how much do we do for them? A lot. The other thing is remembering what Gemma was talking about, the acute phase, getting the prescription from the physician, coming in and seeing us. We want to get you evaluated, make sure what we need to do for treatment, and start the treatment. The intervention phase is getting you into that daily routine. What I tell my patients is, while you're seeing us, it's 50% my responsibility and 50% your responsibility. Until you get to the management phase, then you're well educated. It's all your responsibility. But remember, if you see us, we discharge you. and that good old 120-degree temperature comes up, and all of a sudden you have swelling again in your arm or your leg. Or if you have any type of male cancer, prostate, female cancers, you may get swelling in the private area and in your abdomen. The heat can make that come up again as well. You get a new prescription and you come and see us again. We're not going to leave you out on a cliff. We're always here for you, even if you need to call us and ask a question. And part of the management phase is exercise, the maintenance of yourself, the skincare, wearing compression, and making sure that you're living a lifestyle that's going to help promote your health, right? That's why we're here. We want you to be better. We want to get the lymphedema down. Or someone asked me the other day, no one ever told me 20 years ago when I had my mastectomy that I should have come and seen you. Well, it's never too late. You still can come and see us. The biggest thing is for prevention. We go over all the programs that we talked about. If you've had a lymph node removed, let's say I've had a right mastectomy, my breast was removed, and I had a lymph node removed out of my arm. How many of you know that you should be wearing a sleeve, a compression sleeve on your airplane rides? A few of you, some of you don't. Anytime you've had lymph nodes removed, you need compression, whether it be on the leg or on the arm or on your trunk, to help prevent. And the things that can also help is if you have arthritis, chronic pain, venous insufficiency, neuropathy, the swelling goes down. Sometimes the neuropathy can get better unless the neuropathy was caused by something else. Autoimmune disorders, full body detoxification, aesthetics, that is really big in the spas right now. Post-surgical healing. So we've seen patients after they've had reconstruction on their breast or tummy tucks. It will help the swelling go down there as well. Stress management and wellness. How many of you know that taking a deep breath can decrease your stress? A few of you. Have you ever felt like you've just frantic, your nerves are in a blender? And have you ever stopped and just said, hey, wait a minute, let me take a breath? And look, the world looks better, right? Also, a lot of our patients who have fibromyalgia or dermatological issues, also massage can help. So daily routine is keeping everything open, stimulating the surface and the deep lymph nodes, deep belly breathing to initiate the lymph nodes in your diaphragm and your belly, the ones we can't reach. So those are our references. Is there any questions? I know we've gone over a little bit. Yes, ma'am. That one?
Is there a contraindication for massage with patients who have high blood pressure or heart disease?
You would have to be cleared medically by your physician before you could ever see us. The same thing with if you have active cancer, we have to have a clearance from the physician. It means that we can massage you, but we have to have a clearance medically. Also, another one that comes up is a blood clot. A blood clot, you have to go through the phases of being on medical treatment with a blood thinner. And then when you're deemed cleared and able to have massage, we can do massage. And I know Courtney and Gemma both mentioned infections. If you end up with an infection or cellulitis infection, you have to be on antibiotics for 7 to 14 days, sometimes even another dose of 7 to 14 days, then deemed medically cleared, and then you can see us again.
Thank you.
You're welcome. So we have business cards back there on the back table, and we are located in the Diane and Harry Rinker building. That's where EDOC is, the Desert Orthopedic Group. And we're in the occupational therapy department. So if you are wanting to get a referral to come and see us, you need to ask your doctor for a referral for eval and treatment in the lymphedema clinic in the OT department. And we're right here on campus. No, yes.
If you've had cancer in the lymph nodes and so many have been taken out, how do you massage that area?
So we divert it to other areas that can help drain it. And we would teach you that as part of coming in to see us. So that the area that is not affected is going to take on the responsibility of draining the area that no longer has the lymph nodes So your body has to drain at 100% minus those ones that have been taken out. So as Jimma was saying, we direct the fluid to another healthy group of lymph nodes to help drain. Yes. If you can get your surgeon to refer you to us before surgery, yes, we can do measurements. And then after your surgery, you can come back and see us as part of treatment, and we have pre and post measurements. But sometimes it's very challenging to get that referral in, and sometimes insurances aren't paying for it. But the last thing I want to mention is if you do have lymphedema, there was a LTA law that was passed, the Lymphedema Treatment Act, that now your insurances will pay for your garments. So that's another reason why you need to come and see us, be evaluated, make sure we get the right compression, and then the vendor can then work with your insurance company on getting those sent out to you and paid.
Well, for IHP, it's actually one of the best companies and best insurances to get compression. You should actually get 100% coverage, no problem. If you do come with a referral for a compression fitting to our clinic, we will make sure that we help you with that. Just ask your doctor to send a referral to our clinic for compression fitting for an evaluation and treat, and you'll come on in and we'll measure you and we'll go ahead and put the compression order in with our vendor, and you'll be covered 100%. IHP is one of those insurances that takes care of compression 100%. So just do lymphedema prophylaxis as your so prophylaxis, prophylaxis, and for compression fitting. And they can even say due to lymph node removal on the referral too, just to deem, so if a medical professional looked at that, they're like, yes, there is a compromised lymphatic system, but not necessarily lymphedema.
So I'm sorry, but we're out of time for questions for today. Thank you again to our presenters for all the excellent information, and thank you all for coming today. If you wouldn't mind just signing and returning the consent form and the evaluation, you can drop them over with Cheryl where you picked them up. Thanks again, everyone, for coming.
Thank you.